friends, every one of us know that the whole world is now upset with the outbreak of coronavirus. We can find people panicking everywhere and are becoming more anxious day after day. What causes this anxiety? It is nothing but the fear of getting infected. But are we going to get infected with coronavirus for sure? Definitely not. Keep watching to know why there are least possibilities for us to get infected with coronavirus. To start with, let us all know what is a coronavirus. Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome. The most recently discovered coronavirus causes the disease COVID-19, which was unknown before the outbreak began in Wuhan of China during December 2019. And it is believed that this virus must have spread from one of the wet markets in Wuhan. One will be more surprised to know how COVID-19 spreads. People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when the person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs or exhales droplets. So, what are the symptoms of COVID-19? How do I feel when I get COVID-19? The most common symptoms are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Most people recover from the disease without needing special treatment. Around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. Old people and those with underlying medical problems like high blood pressure, heart problems, or diabetics are more likely to develop serious illness. People with fever, cough, and difficulty breathing should seek medical attention. With this basic knowledge about coronavirus and COVID-19, let us now look into the ways of protecting us from COVID-19. We must stay aware of the latest information on COVID-19 outbreak. Most people who become infected experience mild illness and recover, but it can be more severe for others. One can take care of their health and protect others by doing the following. The first thing one has to do is to wash hands frequently. We have to regularly and thoroughly clean our hands with an alcohol-based hand rub or wash them with soap and water. This has to be done because washing our hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. The next thing we can do is to maintain social distancing. We must maintain at least 1 meter, that is 3 feet distance from us and anyone who is coughing or sneezing. By doing so, we can keep us away and exclude the chances of the virus landing on us or the objects that we carry. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain virus. If we are too close, there are possibilities for us to breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. Do you have the practice of touching your eyes, nose, and mouth often? Then you have to say no for it immediately. You might be wondering why I ask you to avoid touching your eyes, nose, and mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter our body and can make us sick. So better avoid touching eyes, nose, and mouth with the hands. Practicing respiratory hygiene is one of the ways to protect us from coronavirus. We must make sure that we and the people around us follow good respiratory hygiene. This means covering our mouth and nose with our bent elbow or tissue when we cough or sneeze. Then dispose of the used tissue immediately because droplets spread virus. By following good respiratory hygiene, we can protect the people around us from viruses such as cold, flu, and COVID-19. But if you have fever, cough, and difficulty breathing, seek medical care early. We must stay home if we feel unwell. If we have a fever, cough, and difficulty breathing, we should seek medical attention and call in advance. We should not forget to follow the directions of our local health authority because they will have the most up-to-date information on the situation in our area. Calling in advance will allow a healthcare provider to quickly direct us to the right health facility. This will protect us and help prevent spread of viruses and other infections. Some basic questions can help us know better about our routine practices. Question number 1. Should I avoid shaking hands because of the new coronavirus? Yes, respiratory viruses can be passed by shaking hands and touching your eyes, nose, and mouth. Question number 2. How should I greet another person to avoid catching the new coronavirus? To prevent COVID-19, it is safest to avoid physical contact when greeting. Safe greetings include a wave, a nod, or a bow. Question number 3. Is wearing rubber gloves while out in public effective in preventing the new coronavirus infection? No. Regularly washing your bare hands offers more protection against catching COVID-19 than wearing rubber gloves. You can still pick up COVID-19 contamination on rubber gloves. If you then touch your face, the contamination goes from your glove to your face and can infect you. So these are the simplest way to protect us from getting infected with the coronavirus. I hope this video had helped you gain a general awareness on coronavirus, COVID-19 and steps to protect us from getting infected of COVID-19. Meet you guys with more awareness in the next video. Thank you and have a nice day.